Hi, I'm Dr. William Mansbach from the BCAT Research Center. I'm happy to join you again today for the Dear BCAT series. This is the series in which professionals ask specific questions of the faculty. We try to give you an evidence-based set of answers to help out. So today we had an interesting question that came through from a therapist. Looks like an OT from Iowa. Question was phrased in this way: I'm an occupational therapist working in both an inpatient rehabilitation hospital and nursing home. You see a lot of traumatic brain injury patients who have cognitive problems. My question is whether I can use the BCAT test for this population and if I should be looking for specific scores. Letitia. Well, Letitia, thank you for your question. We get this question quite often, not only from occupational therapists, but really from healthcare providers across the spectrum and across settings. So let me answer it in this way. As you are aware, the BCAT is constructed syndromally. By that, I mean, the BCAT is not tied to a specific diagnosis, let's say Alzheimer's disease or Lewy bodies dementia. It's syndromal in the sense that it's looking at global cognition and very specific cognitive domains that cut across all these diagnoses or diseases. So with that in mind, the BCAT is perfectly appropriate for a patient with TBI, just like it's appropriate for a patient with, let's say, vascular dementia. One of the particular values of using the full BCAT for a TBI patient is an analysis of the two-factor scores, the contextual memory factor score, or the CMF, and the executive score. Those two are really important in TBI because you would be looking for possible differences in scope for each of those critical cognitive domains. Now, TBI is interesting because as a category, maybe the most significant impairment is seen in executive function, or what we refer to as executive dysfunction. So the ECFF, which is the executive score from the BCAT, is typically quite low and often lower relative to age norms and education norms than is the CMF, which is the contextual memory factor score. It doesn't mean that a TBI patient, which almost by definition is idiopathic, different based on the individual and the individual situation. It's not the case that you're never going to have memory impairment, particularly in an older person who may already have had memory impairment. But usually the difference between, let's say, normal memory and, let's say, memory in a TBI patient versus normal executive functioning in a TBI patient versus a normal one. That discrepancy there is usually greater on the executive end. As you are aware, the scale scores for the ECFF are 0 to 7. You typically see patients with 5 or less who are TBI. It's a good starting point for identifying potential TBI. The memory scale, which is 0 to 15, you might have people who are below 10, but typically they're going to be above that particular score and usually in the 12, 13 range and sometimes higher. Now, the BCAT should not be the only test for a patient with TBI, but it's a really good way of identifying what's going on in terms of those factor scores and measurement over time. So if you're going to do specific interventions that are cognitive, it would be important to repeat the BCAT. So it's not just the total score that's important, it's really those factor scores. I hope this was a useful answer for you, Letitia. Thank you for your question. And I will invite our listeners to continue to send interesting questions to us so we can answer them on this format, Dear BCAT. Thank you very much.